Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about some things your pediatrician would like you to know. Your pediatrician knows you may be concerned about what's normal and what isn't with a newborn. We're going to talk about some common issues that concern parents. If you're concerned about something in particular, most doctors want you to call the office for advice about taking care of baby. You deal with baby every day. You know her best, so always listen to yourself. If something seems off or wrong, trust your instincts. Your baby is going to cry. It's her only way of communicating with you. As a newborn, she may cry as much as 3 hours a day or more. She'll cry to tell you she's hungry, wet, tired, bored, or upset. As you get to know her better, you'll know what her crying means because each of her cries is different. You'll also be able to tell when something's wrong, such as if she's in pain or ill. Her crying will usually be different in some way if it's pain or illness. It may take a while to connect with baby this way, but you soon will. Call your pediatrician if you become concerned. Baby may lose some weight after birth. It's normal. Babies are born with extra fluid to get them through the first few days. Your little one will lose some of the fluids she was born with. And after the trauma of birth, she may not be too interested in eating. These two situations can contribute to baby's weight loss. Within a week after birth, baby should start gaining weight. If baby hasn't regained her birth weight by the end of 2 weeks, or if she loses more than 10% of her body weight in the first 3 days after birth, your doctor may suggest you also offer her formula if you breastfeed. Don't be surprised or worried if baby spits up. The muscle that closes the opening to the stomach may be underdeveloped. This allows breast milk or formula to back up. Baby really isn't spitting up a lot, no matter how it looks, but if baby starts to vomit, it's a sign that you need to contact your pediatrician. If you bottle feed, keep baby sitting semi-upright when you feed her. You might want to use a slanted bottle to reduce the amount of air she takes in. Burp her during a feeding. Sit her upright after a feeding for a little bit. This helps keep the food down. Most babies have a rash during their first few weeks of life. Baby acne, milia, cradle cap, bumps, and pimples are common. Rashes soon disappear, so you don't need to do anything about them. Baby will cough and sneeze to clear her nasal passages of mucus, dust, and other irritants. When she does, it's probably not a sign of illness. It's the only way she has to clear her airways. Don't be concerned unless she also has a fever or is congested and coughs or sneezes interfere with her eating or sleeping. When you bring baby home, her belly button probably has a black stump that looks kind of shriveled up. You may be leery of cleaning it because you think it might hurt. The stump of the umbilical cord has no nerve endings, so it doesn't hurt baby when you clean it. Wipe the belly button area with alcohol after each diaper change. Give baby a sponge bath until it falls off within 2 to 4 weeks. If the cord stump doesn't fall off after 4 weeks, contact your pediatrician. He or she will want to know about it. You may wonder about baby's bowel movements. What's normal for one baby may not be normal for another. If baby's normal bowel routine changes, it could be a sign of a problem. Call your pediatrician if baby's stools are more watery than normal for a couple of bowel movements or if you notice any blood in the stool. Any fever during the first month of baby's life is extremely serious because infections can advance quickly in a young baby. Baby may not be able to fight infections very well, so call your doctor immediately. Remember, trust your instincts. You know your baby best, so you will probably be the first one to spot a problem. If you'd like to read about baby, check out our book, Your Baby's First Year, Week by Week. We cover many subjects dealing with baby in a weekly format. Each week is a fairly quick read. If you want to find out more about this podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It lists topics about baby covered in our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and other important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.